and I'm here today representing the Health Federation of Philadelphia. I am their community engagement specialist, and I work within a program called the AC Outreach and Enrollment Team. And just a little bit about myself, why is a young man interested in health insurance when most people aren't? At the young age of 18 years old, I did a routine checkup, and my doctor found that the pressure in my eyes was double the normal, a precursor for glaucoma. So, without managed care from that point on, most likely I would have lost my sight. But let's talk about the Affordable Care Act. Let's talk about where we were. So after the passing of the Affordable Care Act and just before the establishment of the marketplace, the number was 15. 15% of Americans, and I would assume it's probably higher than that, who went without insurance, who feared that an emergency room visit would bankrupt them and their family, who feared that they couldn't receive health insurance because of a pre-existing condition, who feared that they couldn't see a specialist. After 2015, we saw that number go down nationally to 9.1%. But what did that number look like here in Pennsylvania? Uninsured in 2011, that number looked like 1.2 million Pennsylvanians. We heard the stories as an organization over and over and over again. People who lived in fear that a slip or an accident at work or at home or at the gym or just while you're walking down the aisle in your grocery store would essentially financially ruin them and their families. Today, with the Affordable Care Act, with the marketplace, and in combination with the expansion of Medicaid, we're happy to say that in Pennsylvania, we're at an uninsured rate of from 14% to 10%. These are people that not just now have access to health care, but know that they won't be denied based upon pre-existing conditions. Young men and women can stay on their parents' health insurance until the age of 26. Thank you, Mom. They know that not only will they receive insurance, but that it will be affordable. 80% of those individuals that receive premium tax credits and cost sharing reductions under the marketplace will get about $226 in premium tax credit to help them pay for their monthly premiums. So they now have that reassurance. It's one less thing that weighs on the shoulders of the mother or the parent, or on the young man and woman who's out of state and they're in college and maybe they just are at a university that just doesn't have the resources to provide health insurance. We're fortunate, we're really fortunate. We now live in a state where pretty much any individual who needs health insurance can now find coverage. That's where we stand today. But there's some more work to do. That still means that 1 in 10 individuals within this state does not have health insurance. They still have that fear that they will go bankrupt. They still fear that emergency room bill that's coming to them in the mail. And so that's where my organization comes in. As a member of the ACA Outreach and Enrollment Program, we have a team of certified navigators that work throughout the city. We're all city, as they say. And we meet with individuals and we do 3 things. We work to screen them to see what sort of care they are eligible to receive. We successfully enroll them in health insurance, and the most important part is we worry about those gaps. We mend those gaps in coverage. If you're transitioning between insurance plans, when things come up and life changes, we meet with you. I want to see every one of the individuals that I've enrolled in at least twice a year. Tell me what's going on. Tell me how I can make sure that you don't come to me one day and you say, I lost my Medicaid, or I lost my marketplace, I don't know what to do, it's been 2 months. So our impact is really working around maintaining people and keeping them in that coverage. Again, we work throughout the city, and I think the most important thing is, you know, we meet people where they're at and when they have the time to do so. If I have to meet you at a Dunkin' Donuts, that's where I will meet you. Good, right, good. If I have to meet you at your university, that's where we will meet you. If I have to meet you at the local library, that's where I will meet you. So, I think the biggest thing I can just step away from this podium and leave with all of you is, you know, we all know at least one person. And they might not say it, but usually you can read it on their face. Let them know. Let them know. You are eligible. You have a right to health insurance, and you can get it here in this state today. If you would like my information or the information of my organization, I will be here for as long as you need. Thank you.